workforce. We're all in this room here familiar with that topic. In fact, we could probably have a wallpaper with workforce just listed all over it. But I'm hearing more and more about a balanced workforce. What does that mean and why does it matter?
It's a complicated term and it's only getting more dynamic. So when I think of a balanced workforce, I think of, do you have the right number of the right people with the right skills, with the right level of, sort of flexibility to be where you need them at the times you need them. Two components of that I think are really interesting. One of them is around, as you think about getting the right balance on teams, what are some of the capabilities we have now of actually saying, what are the skills? What is the tenure mix? What is not only just the basic skill mix, but the dynamic mix between those teams? And how do you balance that out? And how do we use technology to better meet those needs? And then second, with the imperative to really meet dynamic demand of patients, whether it's seasonal or sort of hourly or different acuity, things that we're seeing over time, how do you have the right people with the right flexible either schedules or willingness or excitement to be there? And how do you balance that in a way that lets you, optimize your cost, quality, and your experience as you're doing that?
Okay, that's great. The last few things you said, really talking about what happens if you do this right, and you mentioned cost. Pat, do you have any thoughts on how that workforce balance is helping from a cost perspective?
Yeah, I mean, from my perspective, all of the leaders that I talk to, cost management is, it's a prime factor. And, you're balancing resource needs, and those are balanced with care delivery needs. And whenever you're doing that and you're doing that effectively and you have the right mix model for your workforce, you're going to have the best cost management as well.
Mm-hmm. Okay, so we talked about mix and model. We talked about that it helps with cost. Easier kind of said than done. How do you do it? What's a key enabler for a balanced workforce?
So there are a lot of pieces. As I think about balancing a workforce, you have to start at the very beginning. What do you actually need? What's the demand as your system's evolving, as you're opening up, out of hospital settings and building out your entire capabilities, in person and virtual, really across all aspects? What do you really need? What are the number of people? What are the types of people? What are the dynamics between people? What are the skills that you need today, the skills that you need tomorrow? So that planning component, is where I think several folks do some planning, but not necessarily the robust dynamic planning that'll really set you up for the entire process. Because from there, you get into, all right, let's do our planning. Then let's figure out hiring strategies, retention, recruitment, people strategies. Then let's figure out how we actually have schedules and predictive schedules. What does that look like to actually connect from a technology perspective into other systems? And also, what are the functions or what are the structures that you put people into that let you have flexibility? Are there float pools? Are there different training programs? We had a great conversation last night at dinner around, rotational training and how you can really get folks to understand different aspects. And does this then appeal to this generation of healthcare workforce in a way that you really can't do another way? So there are a lot of components to it, but I think starting the beginning and then going all the way through, as seamless as you can make that entire planning and operationalization process, better.
Mm-hmm.